How long after childbirth should I wait before doing CO2 laser treatment and fillers? Do the hormones of pregnancy and breastfeeding impact the skin and its ability to heal well after laser treatment, or somehow negatively impact the end result of these treatments?
Thank you for your question. You submitted your question without a photo, but you're asking essentially how long after giving birth and breastfeeding is it appropriate to do CO2 laser and fillers? And you ask more about in the substance of your question about how does pregnancy affect the skin and what kind of impact there could be if you were to undergo a laser procedure or injectable filler. Well, I can certainly share with you how I guide my patients who very frequently ask the same question in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Rejuvenating the skin and rejuvenating the face is a very big part of what I do every day in my practice. And all the tools of the trade, such as the use of lasers and injectable fillers and neurotoxins, is essentially how I help my patients look their best every day. So to just simplify the effects of pregnancy in terms of relative risk of the CO2 laser, I would first start by asking what you want to do that requires a CO2 laser. Generally speaking, we use the CO2 laser or the erbium laser for essentially wrinkling and discolorations with the secondary benefit of collagen induction. So the question is, what are the potential risks related to pregnancy? Well, one in particular has to do with pigmentation. There's a condition called melasma, which is associated with pregnancy. It's often referred to as the mask of pregnancy. So the effect of estrogen and hormonal changes on the skin pigmentation is a variable that's important to consider before undergoing a procedure such as CO2 laser. Many times for things that we would maybe consider a CO2 laser for, particularly discolorations that are related to conditions such as sun exposure, sun damage, we can use alternatives that are non-ablative, such as the Q-switch laser, and basically try to minimize the effect of the thermal energy on the skin. Essentially, it is basically a general rule of thumb to allow some time to transpire. And when it comes to something like a laser treatment, and so I would say that 6 months should go by just to get some sense of what the skin looks like and what the stability is before doing some kind of laser type of procedure. The other thing about fillers is, as far as fillers are concerned, injectable fillers that add volume, such as anything in the hyaluronic acid family, is pretty much safe to do at any time. I would say that dealing with the changes of hormonal levels after delivering, it's still going to have an effect on facial volume. So unless someone has a very, very thin face or has a particular area of concern, we can either choose to wait or conservatively add volume as is appropriate. As far as the other options, such as the use of neurotoxins like Botox, Dysport, Xeomin, essentially that particular area is probably safe at any time. There's no data as to the relative risk for breastfeeding women, but essentially because it's a localized treatment, it is very unlikely that there will be much in the serum that would eventually be passed into the baby. So I think that you can consider, if you're used to getting Botox with some consistency, or you like the effect, whether it's getting a Botox brow lift or a Botox lip lift, or doing the things that go with Botox, you can probably get that done a little bit sooner. I think that the doctor you work with in terms of your injectables and lasers should have a sense of your history. Like when we see our patients, a lot of times our patients, we won't see them for a while and they'll tell me they just had a baby. And of course I have their photos before and I do comparisons and I look at any changes and I try to counsel them accordingly. But generally speaking, allowing about 6 months or so to transpire is pretty safe zone after which you're pretty much closer to your pre-pregnancy baseline. Again, depending on weight gain and other variables that, of course, comes with this type of event in one's life. So I think the take-home message, of course, is have a doctor who will watch you and have a sense of what is appropriate. And again, ask yourself, what specifically do you want to achieve with the CO2 laser? One last example, if someone wants to have just a little bit of fractional CO2 laser under their eyes to refresh any wrinkled skin, well, that should be pretty straightforward, and it's not likely to get significantly hyperpigmented depending on your skin type. So it just goes back to essentially more about specific strategies and what kind of outcome, and understanding that what variables can have an impact during this period of time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.